Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Well, we talked last time about vascular dementia and Alzheimer's and kind of left with the question, if there's this big blurry overlap, what does it matter what we call it? And I thought I would ask Dr. Godey what you think about that, because you do the neuropsychological testing. You really look at very finely determined functional implications. What have you seen?
Well, if people come in very early on, when they first notice problems, with classic Alzheimer's, it starts off with memory problems, but the person's ability to function in daily life as far as their familiar home and their environment is okay, but they're very forgetful. And what I notice in the early stages of vascular dementia, and what we've seen in research, is that the frontal area of the brain starts to get a little disconnected. So that and if you've watched our frontal lobe series, you'll understand a little bit more of this, but basically reasoning and judgment, the ability to sequence and to implement a plan and plan ahead an activity and schedule it in, and the family will say, you know, if the person is not doing as much as they used to, they seem to lack initiative, and boy, a lot of contributions to charities that they didn't used to make, and people calling on the phone asking for money. There are some instances in which those kinds of behaviors show up very early on.
So real disorganization.
Exactly.
And you know, there was a family recently who was telling me about going on a sort of a family weekend, and an elderly member of the family who'd always been very high functioning, when they were trying to get out of their rental house, could not get out. Couldn't get the groceries together, get her suitcase packed, get all of those things together, and just kept kind of dithering around.
To the point where the family feels like, well, now we have to tell this person what to do next.
Put this in this box, and then we're going to take
Yeah.
it to the car kind of
Yeah.
thing, really providing all of that direction and structure.
Right.
So that disorganization.
Right, but the person's memory function,
Is
in
fine.
fact, they're testing, and when I test their memory, it's fine. So there, very early on, there is that pretty clear distinction that I can make in the testing and what the family's telling me. But as these diseases progress, you're very right, they begin to look alike. It's as if the family is looking back at those, if you remember in our last series, the little tiny declines day by day look like the Alzheimer's problems over time. You look at person A with vascular dementia at one point, and then you look at them later on, and they seem to have declined like the person with Alzheimer's. In fact, sometimes I just tell the families it's Alzheimer's-like, because it seems degenerative, but it's not. It didn't start out that way. But it's very difficult for families once all of those behaviors are impaired: memory, thinking, reasoning, the person's ability to express themselves. At that point, does it really matter what you call it, as long as you know that it is dementia, that it's a brain impairment?
Well, one reason that it might matter is that the FDA approval for Alzheimer's medications is dependent on diagnosis. So certain of these medications are FDA approved and on label for vascular dementia and Alzheimer's, and some of them are only for Alzheimer's. Now, that does not necessarily mean that people don't use the medications for non-approved. That's a whole nother discussion. But there is some marketing that goes on with that kind of medication consideration.
Well, and what happens is when the doctor gives the family or the patient a sample pack or something like that, and in the paperwork with that, it says the newest drug for Alzheimer's. And I've had families come back to the neurologist or to me and say, oh my gosh, we weren't told that she had Alzheimer's because he gives her this drug and it says it's for Alzheimer's. And we have to explain, I'm sure this happens to you too.
Oh, yeah.
We have to explain, well, the medications were originally designed for that, but there have been findings that they work for other kinds of dementia.
You know, the other reason that it can be important to know about whether it's vascular dementia or Alzheimer's is that if there are cardiovascular issues going on, for example, if somebody is having little blood clots that go into the brain and cause those small strokes, you want to catch those problems and you want to really improve your cardiovascular system with blood pressure control and all of that as well.
Right. In fact, sometimes we'll tell patients and their families, you know, you really need to worry more about your severe heart disease. You've got the pacemaker, the stent, you're on so many medications for blood pressure. That's something that you really need to take care of. It almost supersedes any issues or worries they may have about some memory problems.
So, in some ways, it's important to know the difference. In other ways, for the most part, these dementias are progressive, even the vascular dementias, and even sadly, in many, many cases where all the cardiovascular risk factors, the hypertension and the heart rhythm and all of those things, even when they're well controlled, it can be a progressive deterioration. So in some ways, there's not so much that it matters, but in some ways it can be helpful. I think the bottom line is functionality. You really need to be looking, and that's where neuropsychological testing can be so helpful, or a very careful observer, a good clinician, looking at functionality. What can the person do? What's left to them? How do they go ahead and live with dignity with the skills that they've got left? For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.